Hi, Chris Skelgan here with Pinnacle Training Consulting Systems. We're moving on now to some functional anatomy with daily movements that you see with clients, from squatting to walking to stairs to running. So some of the things that I see as a therapist is, with walking are dysfunctions in the hip and the knees and the ankle. But what I'm doing is I'm looking from the ground up, right? So I hope you, when you're going through this course and with your clients, that you're looking from the feet up. The reason why I bring that up is you want mobility in your foot first, stability in the knee second, mobility in the hip third, and stability in the lower back. Let me clarify that. So if your client has really tight calves and is lacking dorsiflexion, they're not going to get their foot going downstairs, for example, maybe even stepping off a curb, or if their subtalar joint, which is the ankle bone, is not gliding well, that's going to affect the ability to get their foot up or dorsiflex their foot. So mobility is really needed first before stability. Now in the knee needs to be contracted and stable on the front, on the side, and on the back side. The hip has to be flexible. You've got to be able to flex your hip from walking in the walking phase. When I talk about the walking phase is heel strike to stance to push off, back to swing to the next state phase. If the hip isn't moving well, you've got a lot of structures that are tight, you're just going to compensate on the back. Lastly, the lumbar. The lumbar needs to be stable. The core is where everything comes from. Power, hitting a baseball, comes from getting up from a chair, moving on a bed, okay? So with that in mind, I'm going to have my colleague over here come in and visit with me. This is Laura. We're going to look at squatting. So when we look at squatting, what I want you to remember is squatting is something that is the primal movement, it's fundamental, and it's really easy to do. Before we even go into looking at squatting, you can get a good assessment of a client just statically, looking at knee position. Even though she has her leggings on, she can have more shorts. What are their feet doing here? Are they pronating or are they supinating? So again, I'm seeing a little bit of supination both in Laura's feet. I'm seeing a little bit of hyperextension in this left knee. She has good muscle tone in her hips. And again, I'm looking at the hip here, which I can't tell if that's anterior or posterior pelvic tilt or neutral, and I'm looking at pelvic obliquity here. So we're just getting a bird's eye view. Then you go to the shoulders, you can take a look at the carrying of the shoulder, and then the elevation or depression here accordingly. So otherwise it looks good. She's obviously taller, she's going to be leaner. Some of your clients who are shorter, endomorph, they're going to be smaller and they're going to have more fat and adipose tissue, which is going to affect the movement pattern. So I'm going to ask Laura to do a squat. I'm going to give her a hint or cue her and say, listen, I want you to do just a regular squat. How would you squat down one place? Good. And come back up. And then again, one more time. Excellent. Now I'm going to have you look from the side view. So turn to the side, please. Okay. So now we're looking at hip, great trochanter, lateral condyle, and we'll look at the malleus. These are your landmarks here. One with the humeral head and that lateral condyle. Just giving you a point of reference. Okay, so I want you now to squat down for me, please, Laura. Good. Back up, and then back down one more time. So she moves very, very well. And if anything, I felt like she moved without any real issues, and I didn't see any major issues. Maybe a little bit of slight knee past the toes, but moved excellent. One more time for me, Laura, again. Nice control in her lower back. Excellent. Come back up. She's not excessively flexing. Thank you, Laura. I appreciate it. So when sometimes with clients, when they're doing a squat and you see them move, they're going to basically either do something like this, knees past their toes. They may even do increasing of their lumbar flexion. They may even be rotated, right? So now I'm looking at the hip movement, and if the hips are rotated, that does what to the hip? That's going to cause a shearing force. If we look at the front, say sometimes they do like this, and they bring their knees towards midline, well, that's got you thinking maybe it's either groin tightness, but particularly with women, weakness of gluteus medius, right? So some things to think about, okay? When we talk about walking is something we do all the time. When you're looking at a regular person walk, or a walk in general, they should have nice fluidity with heel strike to push off. It should be nice and fluid. They should have nice rhythmic motion in their arm, and really, the hip flexors, you can see in the manual, are constantly active from swing, but the quadriceps are coming from heel strike to mid stance before swing phase occurs. So the quadricep is constantly active in the stages of walking. Stairs, something we all do. When you're going downstairs, you have to step down, which means dorsiflex your foot. Your quadricep is going to slow down eccentrically, right? As opposed to flexing or going upstairs, you're getting flexion of the hip, and we're going to get an extension of the glute, right? And lastly, with running. So if someone's going to run, it's the same thing as walking. You're going to get heel strike, stance, push off to swing. So the hip flexors are the driver for the most part. The quads are controlling eccentrically, but the glutes, glute max, and the hamstrings are extending the hip. So when you look at a client running and walking, and they're not extending their hip, they have tightness in their hip flexors, weakness in the glute maximus, or they may have a joint restriction, okay? I hope that clarified a little bit with these 4 activities. In the future, we'll be talking more about assessing fundamental primary movement patterns, and those fundamental primary patterns you will see in your manual as well. I hope that will clarify too.